you said 15 pounds for a month.
That's a general.
Pretty general. With her particular extra piece about the abdominal muscle that you had to, is that going to take any extra time than the norm?
Not really.
Okay. Okay, good enough.
Yeah, that was just a space or a weakness in between the abdominal muscles. We see this often after C-sections and previous surgery.
Gotcha.
So I go ahead and repair that at the time of the tubal reversal because it really makes your abdominal wall stronger.
So it sounds like, yeah, because she couldn't do sit-ups or crunches very well, and now she should be able to do them.
Yeah, once you're healed, you should be able to start doing them.
I was telling Julia, I broke the rules of the C-section because my baby was greater than 10 pounds, and I wasn't supposed to lift more than 10 pounds. So.
Oh, really?
And they said I could still lift my baby. So.
Yeah. Sure. Those are
the joys of large babies.
Something else that you might experience over the next few weeks is a burning or pulling sensation to one side of the incision or the other.
I think you already felt that once.
A little bit. I figured it's the nerves kind of
that's common
healing themselves. So.
That's true.
And the ibuprofen helps with that. You can also use an ice pack intermittently if you needed it, maybe 15 minutes off and 15 minutes on and 45 minutes off.
Okay.
But that is something that you may experience over the next couple of weeks.
My pain has been really minimal.
Wonderful.
I mean, we followed the Vicodin and ibuprofen the first 24 hours. And within the first 24 hours, I was trying to wean off the Vicodin, spreading it out to every 6 hours and a little bit longer.
That's great.
You were off of it in a day and a half.
About a day and a half, I had stopped the Vicodin, would stay on the Advil.
On a scale of 0 to 10, 0 no pain, 10 the worst you can imagine, what do you think it was the first 2 or 3 days after surgery?
I was saying 2 and 3,
yeah.
But then I was following the regimen of every 2 hours,
great,
taking the medicine. So it was never a large amount of pain.
Well, that's one of the things that I really try to work hard at. Besides making the surgery effective, I like to make it as comfortable as possible. And that's really important, as for outpatient surgery. When people are in the hospital and they're being given narcotics by intravenous injection and all of this, I mean, it's never, pain is never good to experience, but I feel like to make this safe as an outpatient operation, we really have to do things in a way that minimize the amount of pain that people experience after surgery.
Yeah, the first day back at the Sheraton, I didn't hardly even sleep. I mean, it was like I was, very comfortable.
The whole experience was really good. I mean, the way you guys set it up from start to finish, I think was really professionally done.
Great.
Very nice. We were very pleased.
Good.
That's good to hear. And we'll be pleased when we get the positive pregnancy.
There you go. Yep.
And you will receive the email with the 2-week follow-up. We like to get that feedback so we can learn better ways to do things and how we can improve what we do. We'll also be in touch with you at 6 months by phone and at 12 months just to follow up with you. But if you need us anytime in between, you can give us a call or send an email.
Sounds great.